the loss of weight may precede the loss of appetite quite a bit, because if you think about it, as I mentioned, it's harder to take each breath, and then you have to take more breaths to do every single thing. So what sometimes I explain to my patients' families, you don't think you're running a marathon, but just getting dressed and getting your shower is a marathon for you. So you're burning a lot of calories in end stage lung disease just doing normal things. And so that can lead to a lot of weight loss. And then of course, even eating can start to feel like a lot of work at the end of life. So I think there are some appetite stimulants and stuff that sometimes we have patients take. It sort of depends whether or not you use that. It really comes down to like what your goals are, right? So if you're in hospice or palliative care, or like you're in an end of life care or comfort focused care phase of your disease, if it's not bothering the patient, I wouldn't necessarily say they need to eat more, right? Like it's sort of like I typically would do that. We typically go to things like appetite stimulants and stuff when a patient is having a lot of work of breathing and is losing their appetite and losing weight, but we need to get them to a certain weight because they're listed for transplant, or we want to list them for transplant, right? So if there's a goal or a way in which that the weight loss is causing suffering to the patient, then I think it makes sense to consider appetite stimulants. But when you're at the stage of hospice and comfort focused care, I think we have to think about what our goals are and what we're treating. Are we treating the patient? Or are we treating the caregiver because it stresses out the caregiver that they don't eat a hamburger? I mean, and I think we have to be honest about that. And that's actually a great conversation to have with your providers if that's something that's creating anxiety for you.